Now we're going to look into problems in the thigh. It could be the hamstrings or the quadriceps muscle. Very common problem is, especially by sporters, like muscle strain. I marked the area here. It could be an area where you can palpate the muscle problem. You can feel the tension there. You can even feel a small hole in the system, or even a swelling, depending on which time after the injury it is. Here it is very important to kind of optimize the circulation, get the reflow from transportation of metabolites in the area, and get rid of the edema and the bleeding as quick as possible. So marking that is the focus on this area where we have the injury, very common by football players. And this could be a treatment, only thing you do in the start, together with some light exercise just for circulation, and later on you come into light stretching again, and later on after that built up training again. But first we have to get rid of, if it's a subacute condition, we have to get rid of the swelling, we have to get rid of the bleeding, and start to optimize the circulation there to get the fibers to start connecting again and to regrow. And doing that, we put an electrode underneath his thigh. We can use either the rubber electrode or the solid return electrode, like a return electrode, and put it on the front side of his leg. Just to show you, you can switch it very easy on the cable. We can use the solid one for return electrode now, because it's very muscleful front side of the thigh as well. Makes it a good connection. But still we have to have some cream on this, and it's always important to use cream on the solid electrode, the return electrode, to get a good connection. And the more hairy the area is, the more important it is that you have enough cream to get a good connection. So please, sir, would you pick up your file a little bit and down? Thank you. Now we place that one, then we put some cream on the treating area. And then we go to the menu on the machine, we pinch the thigh, and we get the thigh hamstrings contusion up as diagnosis. We put OK, and we get the preset intensity and time. Then we just pinch on button on the machine, and then we're ready to go with the treatment. And like you see where I marked where the injury problem was. I work it at least twice as much proximal of the injury to open the circulation for a reflow and get rid of the edema and the bleeding as quick as possible and as good as possible. Work the area and ask the patient continuously, it's not getting too warm, sir?
No, it's okay.
Okay, thank you. If the patient says and tells you it's getting too warm, then you just pinch the minus button on the handheld treatment head once and continue your treatment. Be sure not to stop your treatment head, move it all the time. Stopping by being interrupted by a discussion with the patient, or try to pinch it and stop it to pinch it while you have contact, might give the patient a slightly burning sensation. That's not the point. So I always do that. I take it off, pinch it once, and then I go back treating again. And there's no problem going on and off with the treatment head. So, and after finishing, we hear a beep sound on the machine. Then when the treatment is finished, after the preset time, I just give a short demonstration here. Then we have to clean the area, take away all the cream, take away the cream on the treatment head, and use some spiritus and antibacterial stuff to clean it, just to disinfect it properly. Doing that, then we have to also use water or disinfection on this thigh to get rid of the rest of the moist and the cream, so it gets a dry, nice skin afterwards. And of course we ask the patient to pick up his leg again, take away the solid return electrode, clean that as well. Also disinfection on that one. and I seems to disinfect even more than the patient and the tools. So, and then we have to clean his front side as well.